Today I am going to discuss about blood pressure. Blood pressure is the force exerted by the blood against the walls of the blood vessels as it flows through them. Then systolic pressure is the highest degree of presence exerted by the blood against the walls of the blood vessels during the ventricular systole when the left ventricle is forcing the blood into the aorta. Diastolic pressure is the lowest pressure that occurs when the heart is in its resting period just before the contraction of the left ventricle. Pulse pressure is the difference between the systolic and diastolic pressure and represents the volume output of the left ventricle. The average blood pressure for the healthy adult is usually about 120 by 80 mm of Hg. A systolic pressure above 150 or below 90 mm Hg is regarded abnormal. What is hypertension? Hypertension is a condition of abnormally high blood pressure and hypotension is a condition of abnormally low blood pressure. Then factors causing variation in blood pressure. First one is age. Blood pressure is lower in children than in adults. Pressure gradually increases until 45 to 50 years. After that, it increases sharply. Sex. There is no difference in blood pressure values between boys and girls until puberty. After that, females usually have a lower blood pressure than males of the same age until menopause when their pressure reading increases over men's. Then body build. BP is higher in persons with overweight than in persons of the same age with normal weight. Weight reduction usually decreases the blood pressure. Then races. Certain races, example black people, will have higher BP reading than other races. Climate. Pressure norms are lower in tropical climates than temperature and highest in polar climates. Then time of the day. In all persons, BP is lowest in the early morning and then rises to a peak in the evening, then it declines. Then exercise. Muscular exertion will raise the blood pressure. Then pain. Severe pain may cause temporary and marked increase in the blood pressure. Emotion. Fear, worry, excitement and other emotional factors will raise the blood pressure to greater level. Blood pressure is more likely to be raised in persons who live in stressful urban environments or who have jobs with constant mental tensions than in persons leading relaxed lives. Posture. It is often stated that BP is lower when lying down than when sitting or standing. When BP is decreased suddenly on standing posture, it is called orthostatic hypotension. Then disease condition. Disease affecting the circulatory system and kidneys may increase the blood pressure. Diseases that weaken the heart action may lower the blood pressure. Then drugs. The drugs such as amyl nitrate and nitroglycerin cause a decrease in the blood pressure. Certain drugs increase the blood pressure. Then hemorrhage. Hemorrhage causes a low blood pressure by decreasing the volume of blood in the blood vessels. Then increased intracranial pressure. Pressure in the cranium usually produce a rise in the blood pressure. Example, head injury and intracranial tumors. Thank you.